I know when I'm treating patients with acne or I treat a lot of pigmentary issues being in Texas, and I have a large patient population of skin of color. So particularly things like melasma and then PIH, that's a direct result of acne.
Of course.
I tell them, look, we have to learn to manage these conditions. There's not a cure.
Right.
Boy, wouldn't we be rich if there was a cure.
Exactly.
But we're having to learn to manage these things in order, and I guess that is kind of good for our business. I guess we wouldn't really have too much to be doing if we had cures.
Well,
and there are
no one's probably as close as we came. I mean, it doesn't necessarily cure it. We do have a lot of patients who take it multiple times.
Right.
Yeah,
especially the ones with more
manage
severe.
a lot of conditions.
Yeah.
And there are a lot of tools. I mean, there really are, but I think
lactone, I think, has really changed
that's changed a lot.
And the oral. I have so many patients that
they
one stops working or they switch over to the other or they do a combination of both.
But I think it's really getting, for us as estheticians, it's really, I said in my acne talk, we are acne detectives, right? We spend that time really understanding their life, their lifestyle, nutrition, everything.
I was just gonna ask you talk nutrition with them.
I mean,
you now as dermatologists more than ever.
Out. I mean, that's not my specialty. I understand that the importance, and we had our panel on integrative skincare. So talking about treating a patient as a whole, not just trying to put a Band-Aid on the surface of the skin, but are there hormonal issues underlying? Are there dietary things going on? Like, how is your lifestyle? Do you smoke? Do you drink a lot of alcohol? How do you sleep at night? What are your stress levels? If your cortisol is high, that acne is going to flare like you wouldn't believe.
Can't fight stress.
No. And just like you can't work out a bad diet, we can't treat other poor lifestyle habits. So I tend to I have a list of people that I like to refer out to. It's like, I would like you to go and let's get some better understanding around these suspicions I have. Because I'm not a doctor. I'm not going to diagnose you. But let me send you to a friend of mine who's a dermatologist or somebody who's a nutritionist. Let them run your blood panels. Let's get see what's all the bigger picture.
It's all the tools, but these are all the tools of the toolkit.
Detective work too.
Yes.
So that
when do you recommend this? When you pull out that tool in the toolkit? I mean, it's a
such
puzzle.
A multifactorial condition. There's so many things playing in, from the lifestyle issues, the hormonal issues, the stress. There's just so much that plays into it.
And
in
one
general.
of the things that, for my skincare brand, we really make a distinction between teen and adult acne, right? A teen is going to be oilier, more sebum.
Yep.
So you treat that differently.
For sure.
And then, but somebody can all of a sudden be perimenopausal and start breaking out, and you can't treat them with teen products, right? So it's all about healthy barrier, and there's different, solutions that we use for adults versus teens. And that's a good distinction.